Today I'm going to talk about the directions and planes of the body. The goal of this video is to identify positions, directions, and planes of the body with anatomical terminology. When discussing the relationship of one area of the body to another, it's helpful to have a specific position of the body we can reference. We call this the anatomical position. In this position, the body is standing with arms at the sides and palms turned forward. The head and feet are forward, and the feet are aligned at the toe and slightly set apart. There are two other terms we use to describe the position of the body when it's not in the anatomical position. In the supine position, the body is face up, and in the prone position, the body is face down. With the anatomical position in mind, we can now apply directional terms. These terms are helpful when describing the positions of body parts. I'll list them in sets of opposite pairs to make the most sense. The first set of directional terms is superior and inferior. Superior is towards the head, and inferior is towards the feet. For example, the brain is located superior to the heart, while the stomach is located inferior to the heart. The second set of directional terms is anterior and posterior. Anterior is the front, and posterior is the back. For example, the nose is anterior, while the shoulder blades are posterior. The third set of directional terms is medial and lateral. Medial is towards the middle of the body, lateral is towards the side of the body. For example, your big toe is the medial side of the foot, and your little toe is the lateral side of the foot. The fourth set of terms is proximal and distal. Proximal is toward the trunk of the body or point of attachment, and distal is away from the trunk of the body or point of attachment. For example, your elbow is proximal while your fingers are distal. Similarly, your upper thigh is proximal while your foot is distal. The fifth set of directional terms is superficial and deep. Superficial is near the surface, and deep is away from the surface. For example, your skin is superficial. Your bones below it, though, are deep. Okay, let's finish up by talking about body planes. And a plane in this context is a flat surface. So think of these as ways of sectioning or cutting the body. The first is the frontal plane. It divides the body into anterior and posterior sections. Think front and back. The second is the sagittal plane. It divides the body into right and left sections. If the plane divides the body into two equal halves, as shown in the picture here, it's a unique type of sagittal plane called the mid-sagittal plane because it goes directly down the middle of the body. The third is the transverse plane. It divides the body into superior and inferior sections. Think upper and lower. Now, understanding planes of the body is essential to be able to interpret medical images such as ultrasounds, CT scans, and MRI scans. So, to sum up, I've introduced you to the anatomical terms for positions of the body, directions of the body, and planes of the body.